Hello, my friends. I'm Dr. Linda Parker, urologist and senior health specialist. And today, we're going to talk about the one surgery I see seniors regret most. Not because it was wrong in every case, but because it's often done too fast, for the wrong reason, with the wrong expectations. It's the kind of decision that seems obvious when you're in pain, exhausted, and just want your life back. And yet, months later, many people quietly say the same sentence. If I'd known what I know now, I would have tried something else first. Let's break a myth right away, because it keeps good people trapped. The myth is that aging automatically means you must accept declining mobility, daily pain, and a shrinking life. No. Aging changes the body, yes, but decline is not a requirement. And surgery is not the only doorway back to function. The purpose of this video is simple and direct. I want to show you the surgery seniors most commonly regret, why regret happens, what to do instead first, and how to decide intelligently if surgery truly is the best path for you. Not with fear, with clarity, not with shame, with power. Because your body deserves strategy, not desperation. Now, what is the surgery? For many older adults, the most regretted surgery is elective spinal surgery for chronic back pain, especially procedures like decompressions and fusions done for wear and tear changes, degenerative disc disease, arthritis, stenosis, without a clear, specific, fixable cause. And let me be precise. Spinal surgery can be life-changing when it's done for the right reason: progressive nerve damage, severe structural instability, certain fractures, certain tumors, specific emergencies. But when it's done for long-standing pain that is more diffuse, more chronic, more tied to deconditioning and inflammation, outcomes are far more unpredictable. And unpredictability is the birthplace of regret. Here's the problem I see over and over. A person turns 65, 72, 79. They've been pushing through back pain for years. Then something flares up. They bend, twist, step wrong, lift a bag. Suddenly, the pain isn't just a nuisance, it's a thief. It steals sleep. It steals confidence. It steals the simple joy of walking around the block without planning every step. They go to the doctor, they get imaging. An MRI often shows a list of scary words: bulging discs, narrowing, degeneration, arthritis, stenosis. And the mind does what minds do. It turns pictures into conclusions. My spine is broken. I'm crumbling. I need to fix this before I end up in a wheelchair. Then the pipeline begins: a referral, a consult, a confident explanation with models and diagrams. Here's the compression. Here's the narrowing. We can clean it up. We can stabilize it. And when you're in pain, the word "can" sounds like a promise. But here's what rarely gets said clearly enough. In older adults, imaging findings and pain do not always match. Many people with terrible MRIs feel fine. Many people with modest findings feel miserable. Because pain is not just structure. Pain is nerves, inflammation, muscle weakness, stress hormones, sleep loss, fear, movement patterns, and the brain's threat system getting stuck in high alert. So if you treat chronic pain like a purely mechanical problem, you can end up fixing a picture without fixing the person. And that is how regret is born. Let's talk about the common difficulties that lead people to choose surgery too fast. First, the fatigue. Chronic pain is exhausting. It turns normal life into a negotiation. Second, the fear. You start avoiding movement, not because you're lazy, but because you associate movement with punishment. Third, the frustration. You've tried a few things and nothing stuck. Or the wrong things were tried in the wrong order. Fourth, the loss of identity. When you can't garden, travel, play with grandkids, or even stand long enough to cook, you don't just lose function, you lose a piece of yourself. And fifth, the pressure of time. Many seniors feel, if I don't fix this now, I'll lose my chance. So they choose the most dramatic solution, hoping for the most dramatic relief. Now let's step into the heart of the issue. Why spinal surgeries are often regretted. One reason is that recovery is not just healing. Recovery is a full-body project. After surgery, many older adults face a cascade they didn't expect. Reduced mobility, disrupted sleep, appetite changes, constipation from pain meds, dizziness, weakness, fear of movement, and a long period of feeling fragile. And fragility changes behavior. People move less, they lose muscle, they lose balance, they lose endurance, and the back, which needs strong hips, glutes, core stability, and confident walking, gets even less support. Another reason is that outcomes can be mixed. Sometimes leg pain improves, but back pain remains. Sometimes one area improves, but another starts aching because movement patterns change. Sometimes scar tissue irritates nerves. Sometimes the body doesn't like hardware. Sometimes the spine above or below the fused area degenerates faster because it has to compensate. And sometimes the hardest outcome is emotional, the disappointment. Not because the surgeon failed, but because the expectation was never calibrated. The person expected, I'll be back to normal in a few weeks. But the body says, this is a marathon. Now let's talk about what to do instead. What I want you to try first before you let anyone schedule a date on a calendar. I call it the 3-lane plan. Lane 1 is calming the system. Lane 2 is rebuilding the support. Lane 3 is deciding with evidence. Let's start with Lane 1, calming the system. Chronic pain often keeps the nervous system in a loop of threat. When the body feels threatened, muscles guard. When muscles guard, you get stiffness. When you get stiffness, you move less. When you move less, you weaken. When you weaken, pain returns faster. So the first natural resource you need isn't a pill. It's a daily practice that tells your nervous system, you are safe enough to move. One of the simplest is breath-led walking, not power walking, not punishing cardio. Walking at a pace where you can breathe slowly through your nose or gently through pursed lips, letting the shoulders drop, letting the jaw soften. 10 minutes twice a day beats 1 heroic hour once a week. Because the goal isn't to prove toughness. The goal is to teach your system consistency. Add heat when stiffness is high, warm showers, heating pads used safely, gentle movement after. Add sleep protection like a ritual, low light, consistent bedtime, and removing late caffeine. Because pain and poor sleep feed each other like 2 mirrors reflecting the same storm. Now Lane 2, rebuilding the support. If you want fewer surgeries, you need more muscle. Not bodybuilding muscle, support muscle. The spine is like a mast on a ship. It needs cables. Those cables are your glutes, hips, deep abdominal muscles, and upper back. In seniors, one of the most powerful instead strategies is a simple strength progression. It can start ridiculously basic. Sit to stand from a chair, slowly, using your hands only as needed. Wall push-ups, side steps holding a counter, heel raises. A gentle hip hinge practice with support. This looks too simple until it changes your life, because strength gives you something medicine often can't. Stability you can feel. And when you feel stable, pain loses its authority. One of the biggest benefits here is improved circulation. When you build leg and hip strength, you improve blood flow through the lower body. When circulation improves, tissues recover better. When tissues recover better, inflammation quiets down. This isn't magic, it's physiology. Another benefit is balance and fall prevention. Many seniors don't realize how closely back pain and fear of falling are connected. If your balance is shaky, your body tightens. If your body tightens, your back compresses, and suddenly you're living like you're carrying a tray of glasses all day. Careful, guarded, braced. Strength training, even gentle, gives you back your steadiness. A third benefit is confidence. And I don't mean motivational poster confidence. I mean the quiet confidence of standing up from a chair without thinking, of walking without scanning for the nearest place to sit, of feeling like your body belongs to you again. Now, lane 3, deciding with evidence. If you do not urgently need surgery, I want you to earn your decision. That means asking better questions than, can you operate? Here are the questions I want you to take into every surgical consult, especially for spine procedures. What is the exact pain pattern you believe surgery will fix? Is it leg pain from nerve compression, or primarily back pain? What percentage improvement do you realistically expect, and in which symptom? What are the most common complications in people my age with my health profile? How long is the typical recovery to walking, to driving, to sleeping normally? If I do nothing for 3 months and commit to a structured rehab plan, what's the risk? What are the non-surgical options you recommend first, and why have they not been fully tried? How many of these procedures do you do per year, and what is your complication rate? And one more that matters deeply. If this were your parent, would you recommend the same surgery at the same time? That question changes the temperature in the room. Now, let me give you something practical, an instead plan you can start this week if chronic back pain has been steering your decisions. First, commit to a 6-week foundation before deciding on elective surgery, unless you have red flag symptoms. 6 weeks is long enough to see a trend. Not perfection, a trend. Week 1 and 2, daily walking in small doses plus gentle mobility, hip circles, ankle pumps, and slow stretches that never provoke sharp pain. Week 3 and 4, add strength, 3 days per week, sit to stand, wall push-ups, side steps, heel raises, and a very gentle core brace practice. Week 5 and 6, increase the load slightly, either more repetitions or slightly harder versions, while keeping walking consistent. During all 6 weeks, track 3 numbers daily. Pain, 0, 10. Steps or minutes walked, quality of sleep. Poor, okay, good. If pain stays the same but sleep improves, that's progress. If pain improves but walking stays the same, that's progress. If walking improves and pain improves, you're building a new future. And if nothing changes after a truly consistent 6 weeks, then you're not failing. You're gathering evidence that a higher-level intervention might be appropriate. That's a smart path. Now let's talk about the red flags, because I never want someone to ignore something urgent. If you have rapidly worsening weakness in a leg, sudden loss of bladder control, numbness in the saddle area, fever with severe back pain, a history of cancer with new severe pain, or a serious fall with suspected fracture, that is not a try walking moment. That is a get evaluated promptly moment. But most people watching this are not in that category. Most are dealing with the slow grind of chronic pain. And for them, the first line instead is not surrender. It's restoration. Now I want to share a few brief stories, because sometimes you need to see yourself in someone else to believe change is possible. I remember a man in his late 70s who told me, "I'm booked for surgery. I can't do this anymore." He had stopped walking because it hurt. He had stopped strength work because he feared damage. He had stopped seeing friends because sitting was uncomfortable. His world had shrunk to the size of his pain. We didn't argue with his MRI. We worked with his body. We started with 5 minutes of walking after breakfast, 5 minutes after dinner. We added chair stands, just 5 at first. We improved hydration, because dehydration stiffens muscles and irritates nerves more than people realize. We changed his daily posture habits. No more collapsing into the couch for hours, but gentle breaks every 30 minutes. 8 weeks later, he said something simple. "I forgot about my back for an hour yesterday." That sentence is a miracle in chronic pain. He postponed surgery, not out of denial, out of regained power. Another story is a woman in her early 70s, a caregiver for her spouse, who felt trapped. She believed surgery was the only way to keep caring for the person she loved. But she didn't have months to recover from a major procedure. So, we designed a minimum effective dose plan: walking, targeted strength, and a physical therapist who focused on function, how to lift safely, how to turn in bed, how to get in and out of a car without flaring pain. Her pain didn't vanish, but her capacity expanded. And capacity is what gives you back your life. Now, let's be honest about something. Sometimes, what to do instead includes medical tools that are not surgery, physical therapy done correctly, pain management that prioritizes function, not numbness, injections used selectively, not as a never-ending loop, medication review because some medicines increase dizziness, weaken muscles, or disrupt sleep, treating constipation and sleep apnea, which can intensify pain and inflammation, correcting vitamin D deficiency if present, because low levels can worsen musculoskeletal discomfort and weakness. This is not about being natural versus medical. This is about being strategic. Now let's bring it home with the core truth. The one surgery seniors regret most is usually the one they chose when they felt cornered, when fear made the decision, when pain spoke louder than planning. So here is the one-sentence conclusion I want you to remember. Before you let anyone operate on your spine for chronic pain, rebuild your strength, calm your nervous system, and earn your decision with a real 6-week trial. Because the best surgery is the one you don't need. And I want you to hear this with hope, not pressure. It is not too late to recover vitality. It is not too late to restore movement. It is not too late to feel like your body is on your side again. Even if you're 70, even if you're 80, even if you've been hurting for a decade, your body responds to consistent signals, small signals, repeated. Now, as we close, here's my gentle invitation. If this message gave you clarity, take a moment to reflect. Are you choosing a solution, or are you trying to escape a feeling? If you've faced this decision before, share your experience in the comments. What you wish you'd known earlier might protect someone else. And if you want more conversations like this, clear, practical, and focused on living well in the years that matter most, subscribe and stay with me, because we're building a community of informed seniors and families who refuse to be rushed into regret.